Are you over 60 and notice something different in your body? A symptom that seems harmless but persists or appears out of nowhere with no clear reason? If so, this video could be an important warning for you or for someone in your family. Few people know this, but pancreatic cancer is one of the most silent and deadly forms of the disease. It often manifests subtly, almost unnoticed, especially among the elderly. And one curious symptom, often ignored, could be the first sign that something serious is happening inside. According to the World Health Organization, over 495,000 cases of pancreatic cancer are diagnosed worldwide each year. And the most alarming part? More than 466,000 people die from the disease annually. It has one of the highest mortality rates among all types of cancer. And the reason is clear. Most of the time, it's only discovered when it's already too advanced. In this video, we'll reveal this strange symptom that doctors worldwide are warning about. We'll explain why it's easily overlooked, what other signs deserve attention, and, above all, what you can do today to reduce your risk. If you're over 60 or care for someone in this age group, watch until the end. The information we'll share could save a life. Take a moment now to like the video, subscribe to the channel, and share it with your friends and family. Let's fight misinformation and promote health together. What is pancreatic cancer? The pancreas is a gland located in the upper abdomen, behind the stomach. Though not often discussed, it performs two vital functions: producing enzymes that help digest food and hormones like insulin, which regulate blood sugar levels. Pancreatic cancer develops when abnormal cells begin growing uncontrollably within the organ, forming tumors. The most common type is pancreatic ductal adenocarcinoma, which originates in the ducts where digestive enzymes pass. The biggest challenge with this cancer is its silent behavior. In early stages, it usually doesn't present clear symptoms, making early diagnosis difficult. When signs do appear, the tumor has often already spread to other organs, limiting treatment options. According to the American Cancer Society, pancreatic cancer accounts for about 3% of all cancers in the U.S. but is responsible for about 7% of all cancer deaths. This makes it one of the deadliest. The average 5-year survival rate is only 12%, and this number is even lower for patients diagnosed at advanced stages. That's why understanding the symptoms, even the most unusual ones, is vital for increasing the chances of effective treatment. Now that you understand what this disease is and why it's so dangerous, in the next chapter, we'll explore what makes this type of cancer so lethal and hard to detect. Why is pancreatic cancer so deadly? Pancreatic cancer is considered one of the deadliest in the world due to a combination of factors that make it especially treacherous. The first is the pancreas's anatomical location. It's hidden deep in the abdomen, among other organs like the stomach, liver, and intestines. This means a tumor can grow silently for a long time before causing any noticeable discomfort. Another reason is the lack of specific symptoms in early stages. While other cancers may cause pain, bleeding, or visible lumps, pancreatic cancer may only present subtle signs, like loss of appetite, fatigue, or digestive changes. Symptoms often attributed to aging or mild gastrointestinal issues. When symptoms finally appear, the cancer has usually already reached important blood vessels, nearby organs, or spread to other parts of the body. In these cases, curative surgery, which offers the best chance of survival, is no longer a viable option. Additionally, pancreatic cancer is highly resistant to traditional chemotherapy and doesn't always respond well to conventional treatments. This further limits therapeutic options in advanced stages. Finally, it tends to progress rapidly. For many patients, the time between diagnosis and disease worsening can be just a few months. All this makes pancreatic cancer a silent, fast, and aggressive disease, which is why knowing the signs, even the most discreet ones, is so essential. Risk factors after 60. After 60, the risk of developing pancreatic cancer increases significantly. Aging itself is a natural risk factor, but other elements, when combined, further raise the likelihood of this silent and deadly disease. One of the main factors is family history. People with first-degree relatives who had pancreatic cancer have a 2 to 3 times higher risk of developing the disease. In some cases, this risk is linked to inherited genetic mutations. Smoking is another major villain. An estimated 25% of pancreatic cancer cases worldwide are related to cigarettes. The toxins in tobacco directly damage pancreatic cells and stimulate tumor growth. Type 2 diabetes, especially when diagnosed late or poorly controlled, also has a strong link to pancreatic cancer. There's evidence that changes in insulin and glucose levels promote the emergence of abnormal cells in the pancreas. Another relevant factor is obesity. Overweight individuals are more likely to develop chronic inflammation, insulin resistance, and visceral fat accumulation, which impair the organ's proper function. A diet high in ultra-processed foods, processed meats, excessive red meat, and low in plant fiber is also associated with increased risk. Finally, diseases like chronic pancreatitis, especially when linked to alcohol or gallstones, can cause progressive damage to pancreatic tissue, paving the way for cancer development over time. These factors often accumulate over a lifetime. That's why regular medical checkups, attention to symptoms, and adopting healthy habits are crucial after 60. In the next chapter, we'll reveal the strange symptom that could be the first warning sign. The strange symptom that could be a warning. Imagine waking up one day and noticing something has changed in your body. It's not intense pain or a fever. It's something subtle but persistent. A new kind of discomfort, a sensation you can't explain, but that just doesn't seem normal. Among the most ignored symptoms, and one that could be an early sign of pancreatic cancer, is intense itching with no apparent cause, especially on the skin and arms. This itching may be caused by a buildup of bilirubin in the blood, a bile pigment that rises when the tumor blocks bile ducts. At first, this itching may be mistaken for allergies, dry skin, or even insect bites. But over time, it tends to worsen and may be accompanied by changes in urine color, which gets darker, and stool, which gets lighter, signs of bile duct blockage. Another strange symptom worth noting is a sudden aversion to fatty foods or a feeling of fullness even after eating little. This subtle digestive change may indicate the pancreas is struggling to produce the enzymes needed to digest fat. In the elderly, these manifestations are easily attributed to aging or other benign conditions. However, ignoring these signs can delay diagnosis and compromise treatment chances. If you or someone close to you has noticed abnormal itching, along with digestive and urinary changes, it's time to investigate. The earlier the cancer is identified, the better the chances of effective intervention. Silent signs that shouldn't be ignored. Pancreatic cancer is a master of disguise. It manifests slowly, with subtle symptoms that blend in with other everyday conditions, especially after 60, when the body naturally undergoes many changes. Among the most silent signs is unexplained weight loss. Many people, even without changing their diet or activity levels, begin losing weight progressively. This happens because the tumor affects the pancreas's ability to produce digestive enzymes, impairing nutrient absorption. Another red flag is persistent pain in the upper abdomen, which may radiate to the back. This pain is often described as deep and constant, worsening when lying down, and improving slightly when leaning forward. This type of pain is frequently ignored or treated as a back problem or gastritis. Jaundice, yellowing of the eyes and skin, can also be an early sign, especially when the tumor blocks the bile ducts. Along with it, dark urine, pale stools, and intense itching may appear, as we've already mentioned. Excessive fatigue, loss of appetite, nausea, and constant bloating are also symptoms that, alone, may seem harmless. But when they appear together or persist for weeks, they should be taken seriously. Another often ignored symptom is the sudden onset of type 2 diabetes in someone with no family history who maintains a healthy weight. The abrupt appearance of diabetes may indicate something is interfering with the pancreas's normal function. These signs, though subtle, form a pattern that shouldn't be dismissed. Recognizing these changes and seeking immediate medical guidance could mean the difference between treatable cancer and a late diagnosis. In the next chapter, we'll better understand how the pancreas functions and what happens when it becomes diseased. How the pancreas works and what happens when it fails. The pancreas is a relatively small organ, about 6 inches long, but its importance to the human body is enormous. It performs two main functions, digestive and hormonal. On the digestive side, the pancreas produces enzymes released into the small intestine to help break down food, especially fats, proteins, and carbohydrates. Without these enzymes, digestion becomes inefficient, leading to symptoms like fatty stools, weight loss, and nutritional deficiencies. On the hormonal side, the pancreas produces insulin and glucagon, two hormones that regulate blood sugar levels. Insulin lowers circulating glucose, while glucagon raises it. When there's an imbalance in this production, diseases like diabetes arise. When the pancreas becomes diseased, whether from chronic inflammation, cysts, or cancer, it fails to perform these vital functions. In cases of cancer, the tumor can invade both the digestive and hormonal portions, resulting in poor digestion, metabolic changes, weight loss, and sudden diabetes. Additionally, the pancreas's location places it near important structures like the liver, intestines, and major blood vessels. A tumor in this region can quickly spread to these organs, making surgical treatment more complex. Another common complication is bile duct blockage, which prevents bile release, essential for fat digestion, and leads to jaundice and skin itching. Because it's a silent organ, signs only appear when its function is already compromised. That's why paying attention to subtle symptoms is crucial, especially in people over 60. In the next chapter, we'll discuss which tests can help detect pancreatic cancer while it's still treatable. Tests to detect pancreatic cancer early. Detecting pancreatic cancer in early stages is one of modern medicine's greatest challenges. However, thanks to advances in imaging technology and lab tests, suspicious changes can be identified before the disease becomes uncontrollable, especially if symptoms and risk factors are taken seriously. One of the most commonly used tests is high-resolution computed tomography, CT. It allows visualization of the pancreas's anatomy and can identify nodules, masses, or changes in pancreatic ducts. In many cases, CT scans can indicate whether the tumor is operable or has already spread. Magnetic resonance imaging MRI, with magnetic resonance cholangiopancreatography MRCP, is another valuable tool. This exam provides detailed images of bile and pancreatic ducts and is especially useful for evaluating blockages and small lesions. Endoscopic ultrasound is one of the most precise techniques for visualizing the pancreas. A small ultrasound device is inserted through the mouth into the stomach, providing a very close image of the organ. This method also allows biopsies when necessary. From a lab perspective, a tumor marker called CA19-9 may be elevated in pancreatic cancer patients. Though not specific, it can also rise in other conditions. This test can be useful in monitoring patients with clinical suspicion or confirmed diagnosis. More common blood tests, like liver function and glucose levels, may also show indirect changes, such as jaundice or recent-onset diabetes, raising additional suspicions. It's important to note that none of these tests alone confirm pancreatic cancer. A definitive diagnosis requires a biopsy and histopathological evaluation. But combining persistent symptoms, risk factors, and imaging tests can speed up investigation and allow earlier diagnosis. In the next chapter, you'll understand why this cancer is so hard to diagnose, even with available tests. Why is pancreatic cancer so hard to diagnose? Pancreatic cancer is one of the hardest to diagnose early, and there are concrete reasons for this. The main reason is the pancreas's deep location, hidden behind the stomach and among other organs. This makes it difficult to detect nodules or changes during routine physical exams. Additionally, early symptoms are vague and nonspecific. Mild abdominal pain, loss of appetite, fatigue, or nausea can be mistaken for common digestive disorders, especially in older adults. Often, these signs are treated with medications for gastritis or indigestion, masking the real problem. Another obstacle is the lack of a standard screening test for asymptomatic individuals, unlike breast cancer, mammograms, or colon cancer, colonoscopies. This means tests are usually only ordered when symptoms are already present and the tumor is advanced. Even tumor markers like CA19-9 aren't reliable for screening. This test may show normal results in early stages or be elevated due to benign conditions like pancreatitis or liver disease. It's also worth mentioning that many healthcare professionals don't initially consider pancreatic cancer, especially in patients with no family history or obvious risk factors. This delays investigation and, consequently, diagnosis. The result is that about 80 to 85% of cases are discovered at an advanced stage, when curative treatment is no longer possible. That's why information is one of our most powerful weapons. Understanding the signs, knowing the risks, and insisting on tests when symptoms persist can change the outcome of a diagnosis. In the next chapter, we'll discuss the most common mistakes people make when ignoring this cancer's signs and symptoms. Common mistakes when ignoring symptoms. In many cases, what separates the chance of early diagnosis from an irreversible situation isn't just cancer progression but avoidable human errors, from both patients and healthcare providers. The most common mistake is normalizing symptoms. Loss of appetite, itching, fatigue, changes in bowel habits, and mild pain are often attributed to age or everyday issues like stress, poor diet, or stomach problems. This attitude can delay seeking medical help for weeks or even months. Another dangerous mistake is self-diagnosis. Instead of seeing a doctor, many turn to the internet or self-medication, masking symptoms and delaying proper investigation. By the time they seek care, the disease may already be advanced. It's also common for patients to accept the first diagnosis without questioning it. Often, superficial exams are done, and the problem is treated as gastritis, reflux, or simple dehydration. If symptoms persist, insisting on deeper investigation is crucial. Many family members also make the mistake of downplaying signs in the elderly, believing complaints are exaggerated or a natural part of aging. This leads to neglect and wasted time. Finally, there's a lack of awareness about risk factors. People who smoke, have diabetes, a family history, or chronic pancreatitis often don't know they're in a high-risk group and don't get regular checkups. Each of these mistakes, alone, can delay diagnosis. Combined, they create a dangerous scenario of invisibility and delayed treatment. The good news is they can all be avoided with information, attention to signs, and an active approach to health. In the next chapter, we'll discuss when it's time to seek medical help and which signs require immediate investigation. When to seek medical help. With pancreatic cancer, time is critical. The earlier the diagnosis, the better the chances of successful treatment. That's why knowing when a symptom stops being common and becomes a red flag is essential. You should seek medical help if you experience any of the following signs, especially if they persist for more than 2 weeks. Unexplained weight loss, with no changes in diet or routine. Intense, continuous itching, along with changes in urine or stool. Jaundice, yellowing of the eyes or skin. Abdominal pain that radiates to the back, especially if constant and worse when lying down. Unusual fatigue that doesn't improve with rest. Changes in appetite, aversion to fatty foods, or feeling full quickly. Pale, greasy, or floating stools. Dark urine. Sudden onset of type 2 diabetes, especially in people without overweight or family history. Constant bloating, even after light meals. These signs don't automatically mean you have pancreatic cancer. However, when they persist or appear unusually in people over 60, they should be taken seriously. It's crucial to see an experienced professional, preferably a gastroenterologist or general practitioner with access to imaging and lab tests. If you feel your concerns were dismissed, don't hesitate to seek a second opinion. Prevention and early diagnosis start with not ignoring your body's signals. In the next chapter, we'll discuss what you can do to prevent or reduce your risk of pancreatic cancer. How to reduce your risk. While pancreatic cancer is difficult to prevent entirely, adopting healthy habits can significantly reduce your risk, especially after 60, when the body becomes more vulnerable to cellular imbalances. The first step is quitting smoking. Tobacco use is one of the biggest modifiable risk factors. The toxins in cigarettes directly damage pancreatic cells, promoting mutations that lead to tumors. Another essential action is controlling diabetes. Keeping glucose levels in check through balanced eating, exercise, and medical monitoring reduces the inflammatory and metabolic impact on the pancreas. Diet plays a key role. Diets rich in vegetables, fruits, fiber, olive oil, and fish, like the Mediterranean diet, are linked to lower pancreatic cancer rates. On the other hand, excessive processed meats, red meat, fried foods, and refined sugars should be avoided. Regular physical activity also supports metabolic and digestive health. Daily walks, stretching, water aerobics, or any form of movement help regulate hormone production and combat obesity, another major risk factor. Limiting alcohol and maintaining liver health is also crucial. Liver disease and chronic pancreatitis increase inflammation in the area and facilitate cellular changes. For those with a family history of pancreatic cancer or associated genetic syndromes, more intensive monitoring with periodic tests and specialist follow-ups may be recommended. Prevention comes down to daily choices. And the earlier these habits are adopted, the better the chances of keeping the pancreas and the entire body functioning in balance. If you've made it this far, you now know that pancreatic cancer isn't a common disease and far from predictable. It acts in silence, hides behind subtle symptoms, and when it finally manifests, it may already be advanced. But there's something that can change this outcome: information paired with immediate action. If you're over 60 or care for someone in this age group and have noticed persistent symptoms like unexplained itching, weight loss, abdominal pain, or digestive changes, don't wait for them to worsen. See a doctor. Insist on tests. Question superficial diagnoses. You know your body better than anyone. Take any sudden changes seriously, especially if accompanied by jaundice, fatigue, or new-onset diabetes. Don't underestimate signs that repeat or intensify over time. Also remember there's much you can do to prevent this disease. Quitting smoking, eating clean, controlling diabetes, reducing alcohol, and staying active every day are steps that protect not just your pancreas but your entire body. Most importantly, talk to your family. Share this information. Pancreatic cancer is devastating not just because of its severity but because it strikes without warning. And the only way to fight it is to stay one step ahead. Did you find this content helpful? Then like the video, subscribe to the channel, and share it with those who need to hear this warning. Every view could represent a life saved. And today that life might be yours.